Today we're traveling to the Boston Children's Hospital, the best pediatric hospital in the US, and speaking with their CEO, Sandra Fenwick. She's built an award-winning culture in one of the toughest industries by focusing on the patient experience and the growth of their employees. I can't wait for you to meet her. I am so lucky to be sitting with Sandra Fenwick, CEO of Boston Children's Hospital. You were recently awarded your number 10 female-led CEO of a Boston-based Commonwealth company. Congratulations.
Thank you.
And more importantly, the number 1 pediatric hospital in the US for 6 years in a row. Has that ever been done before?
We have been playing a little bit of cat and mouse with one of our close friends and colleagues, and so we've been a little bit back and forth.
A little back and forth, but 6 years in a row, you must feel a little like the Patriots.
We do, and we're proud to be next to them.
Well, it's good to have competition and keep you honest.
Right.
So we're going to have a conversation about talent, and given that you have 20,000 employees, and hospitals are 24/7, 365 sort of organization, how are you able to keep that performance culture going across so many people, and it never stops, day in and day out, even if it's a holiday?
So I think the most important thing that we constantly talk about, and that I think we hire to and people believe in their soul, is that patients and families are at the center of everything we do. We work on everything from direct care to what the experience is like for that family, to the promise and hope that there's something that can be done for their child, and what the next opportunity and generation of care can be for kids that we can't do anything for today. So no matter what role anyone plays in this hospital, it's about the kids and the family.
So it's clear when I do research on you, the mission is crystal. You've been able to really ingrain and inculcate that into your organization. So you've been in public health your whole career in some form or function. When did you realize talent was such a differentiator in the performance of your organization?
Oh, I think it goes without saying that this hospital and healthcare in general is nothing without people. I mean, we can have the buildings, we can have the technology, we can have the tools, but it all is about people. And so talent is absolutely critical to being able to gather together the right teams, to have the right identity and purpose coming together, and how we respond to the children and families. And so it has just been, I think, intuitive that talent is really what really is going to make or break an organization.
Now, I mean, hospitals have had quite the war on talent. Nurses, we're probably hundreds of thousands of nurses in arrears for all the openings. How do you outcompete the hospitals around you to get the best and brightest?
Well, again, I think it is first and foremost the identity with children. So, I think you attract nurses, you attract physicians, physician scientists, caregivers, and even people in the back office, because first and foremost they want to make a difference in kids' lives.
Right.
So I think that's a driver. But then you have to create the environment, the opportunity for self-fulfillment, for growth, for a reward system that really rewards and acknowledges what they do every day. And so you build on it, and you make it a place that really both attracts but also retains the very best people.
The very best. So, I mean, you have so many different populations, administrative staff, and I'm going to get this wrong because I'm not a hospital insider, but administrative staff, you have doctors, you also have probably heavy researchers, nurses, and how do you keep all of these probably very passionate user groups, all working together when their jobs are so very different but need to be integrated for care?
Well, clearly we have to have sub-teams, because you're not going to put people who really have nothing to do with each other on teams to actually complete something. Although we try and get diversity in solving problems, or we try and get diversity in thinking about the future and strategic planning. So you do bring diversity to, and I mean cross diversity from various areas of the institution. But for the most part, you really have to think about building the right teams in each of the areas that we have responsibility for. So increasingly, that is the way we're going to be taking care of patients. It's the way science is going to be done. It's the way administrative solutions are going to be identified and performed. So those teams are absolutely fundamental. We are a team sport. We used to be very individual, silo-based, and we're desperately trying to break that down.
And when you came on in 2013 as CEO, or even in 1999, how has the culture evolved over those time periods? You know, and how did you leave your thumbprint on that? There's been really some wonderful improvements, and I think we've had some things that have slid back. And so the things that have been improvements are much better communication, clear communication about priorities and about focus, and about constantly remembering that everything we do has to have positive impact ultimately on the kids and families. Two, we have to have a way of thinking about the employee, not just the patient who we're serving, but who is serving them. And so how do we look out for our employees and our faculty and our nurses and our researchers, and what's their life, and how do we make their lives more joyful, more relevant so that they understand the impact that they have, and then how do we take care of them? And that's really where things have gotten harder. Right. Because the challenges have gotten harder, and we need to be more mindful about what it's going to take for those people to want to get up every day and come to work in this place. The environment for healthcare has just been under attack from everybody. About cost and focus and do more with less. Have you felt that just rumble through your organization? Absolutely. And I think we live in Massachusetts in an environment that not only wants to be known for how we're tackling the high cost of healthcare and being able to provide value, both in terms of cost and quality. And so we've been under tremendous pressure for more than a decade, probably more so than the rest of the country. And that pressure has been felt internally tremendously. And so the pressure to reduce utilization, to move the less complex kids out of this place, to do more with less, to ask people to step up and just think about everything on behalf of what we're doing for the patient, the family, society, has put a lot of pressure on people. And they're feeling a little bit like, what about us? Right. Well, your Glassdoor ratings are really quite astonishing. I mean, I've been reading a bunch of them in preparation, and the culture is always mentioned, the importance of mission, and it's, you see great place to work, wouldn't change anything, no cons, except someone attacks a commute. And you're like, what are you going to do about that? Beyond your control. Right. So in 90% approval rating. So even though the tough environment really seems to be shining through, that it's holding up what you're doing. Again, I think it comes back to purpose and mission. Because if you think about our research program, we have 3,000 researchers and people supporting them. They're there sometimes for decades working on a problem to find a solution for a child or for even adults. And it's that constant, it's the resilience, it's the dedication, it's the reason that they come in every day. And that gets people up. I think I mentioned to you before, we have nurses who bring their lunch in and share it with families who are hungry. Oh, that's fantastic. We have people who truly are staying way over their shifts because they want to stay and hold the hands of a child. It goes on and on and on. And that's really what I think makes the difference in keeping people here and keeping them motivated. Well, clearly, if people are connected to the mission, you get that extra discretionary effort that they give you because they want to, not because they have to.
Right.
So what would you tell your 20-year-old self if you could start over, know what you know today about managing people, about the complexities of the space that you're in? Because I'm sure that there are some young leaders out there who look up to you and say, I want to be like her. What would you tell yourself?
Oh, I'd tell myself a lot of things that I've learned over the years. Patience. I think trying to listen before you speak, because there's so much to be learned. And that constant desire to just keep learning every day from someone that can teach you something about being better yourself or being better at what you're trying to accomplish. Having the resilience to get up and do an interview when you really don't want to. Constantly being open to criticism and really listening to that criticism and learning from it and absorbing it and saying it's not just somebody who is ragging on you, but someone who really can make you better. So I would listen to all of those things.
That's fantastic. Well, you're such a fantastic role model. I really appreciate your time. Thank you for imparting your knowledge and your genius, and just in awe of what you've been able to accomplish. Thanks so much.
Thank you. Thank you, Mike.